everyone. Welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their low back and kind of in that butt area, right there, kind of low back, SI joint area. And what's going on with these folks, it's low back pain and SI joint pain that won't go away. They've been seeing the chiro, they've been going to the physio, they've even seen their orthopedist, they're getting treatments, they're getting injections, they're getting the whole bit, exercises, and it's not going away. So, what's going on with these folks? Well, there's actually two things going on with these folks that we're finding. When they come in, they either have one of two or both. One or two or both. One or two or both of these things. One of them is anterior femoral glide syndrome. In other words, the head of the femur kind of sometimes doesn't sit that great in the socket. It's kind of sitting forward in the socket. So it's the hip is having to figure out the low back and the SI joint are having to figure out what's going on. You see, this is a hidden cause of the low back and SI joint pain. It's not the hip, it's not the low back and SI joint, it's the hip joint that we're finding these folks are having problems with. So, the head of the femur is anterior femoral glide syndrome. The head of the femur sits forward in the socket a little bit because, let's face it, we sit way too much. And then, we're sitting like this, right? The head of the femur gets kind of pushed forward in the socket a little bit. And then the posterior capsule, the tissue in which the head of the femur sits in the back gets kind of tight and knotted up a little bit. So that's one of two things, and or both, that's what's going on. The other one is that we're finding that they're missing hip external rotation. Remember, the hip can rotate. So this is internal rotation of the hip. So if I were to do this here, so this is my hip right here. This is the hip joint. This is internal rotation, external rotation. So internal rotation, external rotation. All right? So if you're seated, this is external rotation and internal rotation. Internal rotation, external rotation. And we're finding they're missing quite a bit of external rotation in the hip. So one of those two things, and or both, anterior femoral glide syndrome, it's not sitting well in the socket, it's kind of pushed forward, and they're missing hip external rotation. And these are hidden causes of that low back, kind of low, right, kind of right here, into that SI, and it's just kind of not going away. So how do you fix that? How do you fix anterior femoral glide syndrome and or missing hip external rotation? Two exercises. We're gonna start with how to, at home, get rid of that anterior femoral glide. Get the posterior capsule to loosen up so that way the head of the femur sits in the capsule a little bit better. It's not so pushed forward. So this is what you do for the anterior femoral glide. So here you are, you get up on all fours like this. See that? You get on all fours like this, and what you're doing is you're letting this, let's say I have problems with my right hip, and my right low back and SI joint. And this is what you're gonna do. You're gonna let this left leg, you're gonna use it for support. And what you're gonna do, here, let's do it this way, you kind of see, right there. So you're gonna put it over here like this. So this is my right hip, and I'm letting myself sink into my hip. I'm using my weight to sink into the hip joint, forcing that hip and stretching the posterior capsule. You'll feel this kind of in your butt is where you'll feel this the most as you do this. You're letting you see my back leg here, it's just kind of there for support. But what I'm doing is I'm putting all my weight, it's pushing, my head of the femur is pushing, the femur here is pushing upward from the pressure of the floor, and my weight coming down on it. See that? Boom. Like that. And let's do a front view so you can kind of see. And you can kind of see my back leg kind of trails behind me. So this is almost like a kind of a pigeon. See, the pigeon is like this, kind of a modified pigeon like that. See, this is the pigeon pose, right? But this is kind of a modified pigeon because you're putting this in here like this. See that? You're just kind of search around for those tight corners while you're putting all your weight on this joint. See, I'm sticking my butt out a little bit. Let's do it this way so that way you can see. This way, right here. See that? I'm sticking the butt out a little bit. Man, I can really feel. And I'm kind of rocking back and forth when I find those tight corners. I can kind of rock back and forth on that. Oh, right there. Ooh. Kind of rocking back and forth right in through there. See that? Search around for those tight areas of that capsule, that posterior capsule, like right there. Oh man, that's a good one. And I can put my foot kind of over, put my left foot over there just like this. So this is what it kind of look like. See, his foot sinking into this hip. I don't know if you can see that. So basically I'm trying to stick my butt out. That's a good kind of cue. Just let that upper body sink onto the weight of the hip and kind of stick that butt out a little bit. Wiggle that watusi right there. Side to side. Move forward a little bit. Find those tight areas in that posterior capsule. And eventually you get to a point where you can kind of do a pigeon. So this is kind of like a modified, see, pigeons like this, right? So you're here, and this is kind of like a modified pigeon, if you will. Right there. See that? Boom. Do that 3 to 5 minutes. I know I've tried to demonstrate this for longer than 3 to 5 minutes, but just kind of want to give you the idea, trying to get these, it's kind of hard to get these angles right there. There's a good one. You're really trying to stick that butt out. Boom, right there. Ooh. Get those tight corners, those tight areas in the posterior capsule. So that's the first exercise. Try to get that head of the femur into that posterior capsule, stretching that a little bit so it sits better in the socket due to that anterior femoral glide syndrome. The next one is to, if they're missing hip external rotation, try to increase hip external rotation. So how do you do that? Again, we're gonna go back to that kind of that pigeon, if you will, that pigeon pose. So this is, I think this is called the half pigeon. I'm not a yoga instructor, but I think this is the half pigeon. So this is what it looked like in front. See this is my right thigh and leg, and it's got in front of me like this. Okay. And if your external rotation is not very, very good, you may have to sit up like this for a little while. And then as you get better and better, you sink down into external rotation. See, like that, into that half pigeon pose right there. And work in those tight areas, tight angles. Or you can do what we call the 40-40, 90-90, hip 90-90 stretch. So if it's my right hip that's having, right low back's having a problem, you're missing hip external rotation. So you're gonna be like this. You're gonna have your leg and thigh in this 90-degree configuration. This is my right, this is my left. And the other side is in 90 degrees, 90-90. And you're gonna lean forward, see that? And lean forward, working that external rotation of the hip. And you can feel that right there, woo. You want to keep your back straight. Try to keep your back neutral as you do these. You don't want to be rounding forward. You don't want to be hyperextending as you do this. See that? And you're leaning forward, keeping that back in neutral position, right? And when you get to that end range, just kind of oscillate a little bit in that end range. Just gently, right in there. Again, do these to your tolerance. You want to sit here in agony as you do this. And you can even work the different angles. So you can work it where you start over here a little bit and then work in here, work in here. We call this running the clock. So again, this is 10 o'clock, this is 11 o'clock, this is at noon, this is at 1 o'clock, all right? At 2 o'clock, woo, that's a good one. Working those hours to increase hip external rotation. So, 2 exercises. You want to do hip retraction for the anterior femoral glide syndrome. So you're putting your weight onto the hip here to increase that space for the posterior capsule, that tight posterior capsule. You're kind of grinding out that posterior capsule with the head of your femur. Right there, kind of back and forth on that sucker. Yeah, let your weight, you see most of my weight is just on this. I'm lifting my leg so you can kind of see that most of my weight is on here in that right side. Once that's done, go into working that hip external rotation. Pretty soon that low back pain and SI joint pain that won't go away, you've been seeing everybody for it, gone. Because that's what we're finding with these folks. Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who are battling pain in the low back, kind of in that SI joint, and it's not going away. They're seeing their chiro, they're seeing their physio, they've gone to the orthopedist, they're getting injections, and it's not going away. They may have anterior femoral glide syndrome where the head of the femur is not sitting in a socket very well, and they may be missing hip external rotation that's been missed. Share this with them. Sharing is caring. It's not fun to see your friends and family battling these things that won't go away, and they're spending all kinds of money when these 2 exercises are going to help them. So share this with them. Also, give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.